Okay, Bio47, we're going to start the upper extremity, Lab 13, and I'm going to do it very similar to how I had done Lab 12, lower extremity. So I'm going to go through each of the muscles and then describe a little about the origin, insertion, and action. And remember, you're required to know just the terms that are listed first, and then the information in the parentheses is just simply for your added information if you're going into careers that require more specific locations for origin insertions and then more detail for actions. All right, so we've already looked at the rotator cuff muscles, so this will be a nice place to begin because it's a little bit of a review. When we did our shoulder joint, we learned the rotator cuff muscles as a really important or integral part of the shoulder joint, as the muscles described as the rotator cuff are in fact the greatest stabilizing structure for the shoulder joint. So here we're going to look more at what they're doing for the shoulder in the sense of their actions. So remember, there are 4 rotator cuff muscles, and we use the mnemonic SITS, the acronym SITS, where SITS stands for the first letter of each of the muscles' names. So we have the supraspinatus, infraspinatus, teres minor, and subscapularis. All right, so we'll start with supraspinatus. This muscle, I think, probably is one of the easier ones to remember because the name tells you exactly where the muscle is located. It's very linear. It's a very straight muscle in the sense of its origin and insertion. It's originating in the supraspinous fossa on the scapula, and it's inserting onto the greater tubercle of the humerus. So remember, you have to learn scapula and humerus. If you were to follow the origin from its more medial location to the insertion, which is lateral, you're going to see that the fascicles are all oriented in a very straight plane. And when the insertion is pulled toward the origin, it results in shoulder abduction. Okay? All right, so that's supraspinatus. So even though it is a rotator cuff muscle, this is the only one of the 4 that actually doesn't rotate. So it's a rotator cuff, but its function is abduction. All right, and it's going to be deep to a muscle we're going to learn in just a little bit called the deltoid. All right, our next muscle is infraspinatus. Again, this is one we've seen as part of the shoulder joint. It's sitting in the infraspinous fossa and is also going to the greater tubercle. So it's a nice little muscle because it, again, is located on the bony structure of the scapula that its name is derived from. It does rotate. So when this muscle is pulling its insertion toward its origin, it's going to cause a lateral rotation. So again, that's infraspinatus, okay? And it's the first of the 4 that actually is rotating, right? Okay, our next muscle is teres minor. Teres minor is a smaller of 2 sort of cylindrical muscles on the back of the scapula. Teres minor is going to be originating off sort of that inferior lateral border of the scapula and inserting onto that greater tubercle. Again, when we look at rotator cuff muscles, we're going to find that they all have the same insertion point, which is going to be on the tubercles of the humerus. So the 3 in the back are going to be on the greater tubercle, and the subscapularis, which is in the front, is going to be on that lesser tubercle. All right, so when we look at the teres minor, it is a small cylindrical muscle that is going to be inserting again on that greater tubercle, and when it pulls, it's going to function to rotate the humerus. All right, when we look at the anterior aspect of the scapula, so in this drawing, they've actually removed the rib cage so we can see that anterior aspect of the scapula, filling that space that's between the scapula and the ribs, or that subscapular space, is going to be the subscapularis. So subscapularis is in the subscapular fossa and is inserting onto the humerus on that lesser tubercle. Okay, so we're going to see that it's inserting onto the lesser tubercle rather than the greater, but all of our rotator cuff muscles are inserting around the humeral head on either side of it. All right, and this one is going to cause a medial rotation. So it is going to be antagonistic to teres minor and infraspinatus. Okay. All right, so these are just drawings looking at the rotator cuff muscles from the posterior view. So if I grab my pen and pull this out, we can see that starting up here, let me grab a different color. This is the supraspinatus. There we go. Supraspinatus is this muscle going this way. Again, it's going to go underneath the acromion, and it's going to come out right here. Right? And you can see it attaching to that greater tubercle. There's supraspinatus. Again, this is our only muscle that's going to be a shoulder abductor. That's a rotator cuff. The next muscle is the infraspinatus. That's all of this one. Kind of see the edge right there. Again, you can see the tendons are all merging together in what we call the cuff. And it's also attaching to this greater tubercle. So this is all the infraspinatus. It's quite large relative. And then this little guy that kind of sits on the bottom edge here, right this way, and going around, that's going to be our teres minor. And both infraspinatus and teres minor are going to be causing lateral rotation. Okay, and then this little guy coming out here, just FYI, that's the radial nerve. Okay, and this is a nice cadaver image. It's really pretty. On this one, we can see up here, again, is the supraspinatus. This is the left shoulder, so you can see the spine of the scapula right here, going out to the acromion. Here's the clavicle. Okay, so filling the supraspinous fossa, that's the supraspinatus. Underneath the spine here, there's the infraspinatus. And you can see coming right in a nice sort of cylindrical massive muscle, small. This is going to be the teres minor. And they're all going to converge on the opposite side of the head on that greater tubercle. And then this guy that's kind of coming out here, I'm going to kind of draw the edges of it. It's a much larger cylindrical muscle. And you can kind of see you're going to lose it into the armpit right here as it moves forward. This is teres major. So we're going to look at this one in just a minute. But this one is not a rotator cuff muscle because it's diving below the shoulder joint. It's going to attach to the humerus more on the shaft. So you're going to look at the intratubercular groove rather than around the back of the head. Okay, so teres major, we just mentioned that one. This is not a rotator cuff muscle. It does rotate. It does a number of other things as well, but it's not considered a rotator cuff muscle because it is not supporting the shoulder joint itself. It supports the shoulder, but not the shoulder joint. So it's part of what will move the shoulder, but it's not sort of sitting around this aspect of the shoulder joint. So it's not keeping the head of the humerus against that glenoid fossa. So teres major is going to be originating off this inferior angle, and that's going to dive underneath through your armpit, and that's going to swing to the front of the humerus. And you can see on this side, its attachment point is going to be this inside edge of the intratubercular groove. So when you're feeling your armpit, you're actually feeling partly teres major sitting in the back border of your armpit. All right, so functions, even though it's originating posteriorly, because it swings through your armpit to the front, it's going to have a job in extension. So it's going to pull that humerus backwards and behind you. It's also going to cause the humerus to get pulled towards your body. That would be the adduction. And because it's sitting a little bit forward on the humerus, it's also going to cause a medial rotation, I should say. Medial rotation. Okay, so we get medial rotation, adduction, and extension as its action. All right, so this is just looking at a cadaver image. I did get a chance to take some cadaver videos, so I'll post these a little bit later, where we have essentially this view of our cadaver, and we'll show you, or I'll show you, the rotator cuff muscles on our cadaver, where we're going to see some of this other muscle associated. But again, there's our supraspinatus. This is all our infraspinatus, all of this. Here's our teres minor right there. This guy going underneath, there's our teres major. Okay. And again, there's our supraspinatus going underneath the acromion right there. Okay, so infraspinatus is right there. And again, we have our teres minor and teres major. All right, so our next muscle, this one's new, this one's deltoid. We did see it in our shoulder joint, but I just simply had it removed so you could see the structures of the shoulder joint. This muscle is the most superficial muscle of the shoulder. It actually makes that nice rounded prominence of your shoulder. It's hanging off of the scapula and the clavicle. So it's kind of a little bit underneath them and then drapes down onto the humerus. So origin is going to be the clavicle and the scapula. You can see here as it goes out, we're going to see the clavicle right here, not the entire clavicle, but approximately about a third to a half of the clavicle. And that swings around the acromion and then goes down part of the spine. It's about halfway down the spine. That's the origin. And then the insertion is actually a quite distinct point. All the fascicles are going to go here. And if you remember that deltoid tuberosity, that little washout point on the humerus is where we're going to see the insertion. So this is all deltoid. Its primary action when all of these fibers are contracting simultaneously. Remember, myofibers we can control as individual groupings, but if we contract them all, then what we're going to get is this nice abduction. If we were to contract just these front groups here, we might see a flexion. If we attach the posterior groups, then we would get an extension. Okay, so that's deltoid. We've looked at bicep, so this will be a nice little review as well. Bicep is the first of 3 forearm flexors. So we'll be able to flex at the elbow with the bicep. It does have origin on the scapula, so it does cross the shoulder joint. So technically it also has an action in the shoulder joint, but its primary action is going to be at the elbow. So bicep brachii is a 2-headed muscle. Anytime you have a muscle with multiple heads, those are always going to be origins. In this case, we're originating off of 2 locations on the scapula. The short head, which is more medial in this case, is going to originate right here. This is the short head, more medially and attaching to the coracoid process. And then the long head, which is lateral, is going to have a long tendon that goes through that intertubercular groove and then all the way up on that supraglenoid tubercle, so right above the glenoid fossa. So we have a short head, which is medial, and a long head, which is lateral. And then as we come down, and you can play with this on your own bicep tendon, is in the elbow joint, if you give yourself a little bit of flexion, you're going to see that there's a very distinct rope-like tendon that's going to be attaching to that radial tuberosity on that inside edge of the radius. We do have some medial flares over here on the more medial side, and that's actually an aponeurosis, and it will be inserting into just the soft tissue around the forearm muscles. So that's what you're going to see out here. But the primary point of insertion is really going to be that radial tuberosity. So its primary function is going to be elbow flexion. So we're going to see these forearm bones coming upward in an elbow flexion. All right, so that's the bicep. Right next to the bicep, coming off the humerus, on this medial edge of it, is a muscle known as the coracobrachialis. Coracobrachialis has in its name its origin and insertion. So its origin is always listed first in the name. So we're going to have this nice little coracoid process, which you can see right here. This is going to be the origin. We can see the muscle then is going to come down and attach to the humerus on the shaft, just medial to that deltoid tuberosity. And this muscle here when it contracts, is going to pull the humerus toward the body, and this is going to be a nice adductor. Okay? So deltoid is going to be an abductor, pulling the humerus in this direction, so that would be the deltoid muscle. And then, let's see, I don't know if I can do this very well, but there, deltoid is an abductor, and then coracobrachialis is one of our adductors. All right, it does do a little bit of flexion because it's in the front of the shoulder joint as well. All right, our next muscle is an additional elbow flexor. Again, it's going to be one of 3 elbow flexors, and this is really described as sort of the base of the arm because this muscle, his name is brachialis, is literally attached to this anterior shaft of the humerus, and its insertion point is going to be on the second forearm bone, which is going to be the ulna. So it's a really great straight elbow flexor, whereas the bicep brachii works really well if you have your forearm moving from a pronated to a supinated position. That if you're sort of rotating your forearm outward in a pronated to a supinated position, the bicep brachii works really well for that motion because it's attaching to that rotating radius. But if you're just simply doing a straight elbow flexion, you're going to be exercising and moving and using your brachialis muscle. All right, so it's going to cover the distal anterior shaft of the humerus here. So that's the brachialis muscle. All right, now we're going to move to the posterior surface of the arm. There's a very large muscle there that has 3 heads to it and 1 insertion point. The 3 heads are named the long head, the lateral head, and the medial head. In most drawings, you're always going to see the long head and the lateral head. The medial head is much more difficult because it's sitting underneath the lateral head. So when we look, we're going to see the 3 insertion points. 2 of them are going to be on the origin points. 2 of them are going to be from the humerus, and 1 of them is going to be from the scapula. So when we look, the first origin, we're going to see right here. This is off the scapula. The only head that originates off the scapula is the long head, and you can see it coming off of this infraglenoid tubercle, and then traveling down. You see a really thick tendon around the back of the tricep muscle, and it's going to be attaching into the olecranon of the ulna. So origin for the long head is going to be scapula. Insertion is going to be olecranon of the ulna, and the action is going to be elbow extension. The 2 other heads originating off the posterior shaft. We have the lateral head here, which is pretty easy to see, coming off the superior lateral portion of the shaft. And then underneath it, coming off of this more posterior inferior aspect of the shaft, although we can't see it in this drawing, would be the medial head. All 3 heads are going to be inserting into the tricep tendon and inserting onto the olecranon right here. So all 3 have the same action, which is going to be to extend the elbow joint. So it's really going to be the antagonistic muscle to our 3 elbow flexors. All right, so one side note I have down here, I'll show you another figure we can see it. One of the great things about this long head of the tricep is that the tendon here is actually going to split the teres major from teres minor. So teres minor would actually be coming in this location and sit essentially on top of the long head of the tricep and it would basically cover it. So if we had teres minor, it would sit like this. And then teres major is going to come this way. And at this point, it's going to go in front of the long head here. So the long head of the tricep actually splits teres minor from teres major. So if this is teres major here, we get a different color. If this is teres major here, then I'm going to see that it will be split. So here's the teres major muscle, goes in front of, teres minor goes behind. There you go, that's kind of nice. Goes behind the long head of the tricep. Okay, so that's when you look in dissection, it's a really nice landmark because we see that split there. Okay, so this is, oh, I didn't have to draw. This is a nice view of that. In this case, we can see here, this is that nice little teres minor muscle. And then this is the teres major muscle. And we can see the nice long head of the tricep right here, splitting those two. So there's the long head. Here's the lateral head. You can see the tricep tendon and inserting onto the olecranon. So that's really what we can see. We typically don't see that medial head. All right, so again, what we have here is the tricep muscle, and it's going to be a nice elbow extensor. All right, our next muscle is another forearm flexor muscle. So it will complement our brachialis and our bicep brachii. This muscle is named the brachioradialis. You can see that its origin is the brachium, and its insertion is the styloid process of the radius. So it's a quite long muscle. It's going to come down this lateral aspect of the extremity, and you can see it coming all the way down to this very distal aspect of the radius. So that nice styloid process way out here on the radius is the insertion. So its action is actually going to be right at this elbow joint here, and that'll again be to flex the elbow. So origin is going to be the humerus. We're going to see it's really coming off of this nice lateral epicondyle and distal shaft. Insertion is going to be the styloid process of the radius, and the action is going to be flexion. When you look at your forearm, if you kind of have your hand in a supinated position, the lateral aspect of your forearm has a nice kind of rounded prominence, and that's really the prominence produced by the brachioradialis. Right, and so I have here two notes. The belly of the muscle lies over the bone of insertion. In most cases, the belly of the muscle lies over the bone of origin. The belly of the muscles are typically more proximal, but in this case, the belly of the muscle tends to be a little bit more distal. And then the brachioradialis is a really nice landmark muscle in the forearm because it will help separate our flexor muscles from our extensor muscles. The flexor muscles are all going to be on the anterior aspect. There we go. The anterior aspect medial to brachioradialis. And then if we were to flip it over, we'd find that the extensor muscles are going to be on the other side of brachioradialis posteriorly. All right, so this is the nice brachioradialis muscle in the context of the other forearm muscles. And again, if your hand is in a supinated position, you're going to see it right here. This is the brachioradialis muscle. And the really nice thing about it is if you're looking, the nice sort of rounded prominence on that lateral aspect of your forearm is really made by this muscle. So there are three elbow flexors. You can see them here. One is going to be the bicep brachii. You can see the tendon right here, and this is that little aponeurotic fibers coming medially. The second is underneath brachioradialis. It's this guy right here. So that's brachialis. And then we have our third elbow flexor, which is going to be brachioradialis. Okay, so these are the three elbow flexors. It's kind of nice here because they're just highlighted among all the other muscles. But again, bicep brachii, brachialis, and then brachioradialis. One of the important things about having three different elbow flexors is because the forearm can be positioned in a variety of directions. So when you think about flexing, you can flex your elbow when your elbow is supinated. You can flex your elbow when your elbow is pronated, and you can flex your elbow when your elbow is partway in between. Kind of think of it when you're giving yourself a thumbs up. So when we think about a supinated position, that's really brachialis functioning quite nicely. If you're in a pronated position or giving yourself a thumbs up, that's going to be your brachioradialis. And then bicep brachii is kind of really moving through from a pronated to a supinated position. So it gives you a lot of power through all those different movements of the forearm. All right, so now we're going to move into the forearm muscles. The forearm is actually quite dense with lots of little muscles. So one of the very first muscles that's a landmark muscle that kind of gives us positioning in the forearm is a muscle called pronator teres. Pronator teres is going to be originating off of the medial epicondyle of the humerus. We're going to find that most of the forearm muscles that are anterior are going to start off that medial epicondyle, which is why it's so much larger than the lateral epicondyle. We see a lot of our flexor muscles are going to be sitting here. But pronator teres is going to come across from the medial epicondyle way over to the opposite side of the radial bone, and I'm sitting on the shaft of it, that distal side or distal lateral side. And so its job is going to be to rotate the forearm in a pronation. So hence the name pronator teres. Now, just like teres major and teres minor, the muscle has a very cylindrical shape to it. So that's why they call it pronator teres. All right, so that's the first one. It's also going to be, like I said, a landmark muscle, because if we look at pronator teres, and if we had our bicep muscle, the bicep muscle is going to come down here, and it's going to be attaching with a really thick bicep tendon here. It creates a really nice kind of V here to this elbow joint. All right, so I can see here, this is the pronator teres. Oops. Pronator teres. Starting here on this medial epicondyle, and then coming across. You can see it goes underneath these little aponeurotic fibers. And then here's this nice tendon of the bicep muscle. So they kind of create this nice little V here. Okay. All right, so that's pronator teres. And then this muscle, big muscle again, this is our brachioradialis that was sitting laterally in our forearm there. Okay, so our next muscle is our palmaris longus. Palmaris longus is a really neat little muscle. They estimate that about 10% of our population actually is missing a palmaris longus, where the tendon gets converged into one of the two flexor muscles of the wrist. But if you have it, which most of you will, its origin is going to be this nice medial epicondyle, and then it's going to have a pretty small belly and a very, very long tendon that comes down. And instead of inserting onto muscle, we actually find it flares into a really broad sort of aponeurosis here in the skin of the palm. So it actually doesn't have a bony insertion point, but rather into this thick aponeurosis of the palm. So that's one of the reasons it's called palmaris longus. It has a long tendon inserting into the palmar fascia or the palmar aponeurosis. You can tell if you have this little muscle if you take your wrist and you do a really great flexion. The best way to see it is if you take your pinky and your thumb and kind of bring those two digits together, and then give yourself a little bit of wrist flexion. You're going to see this little tiny rope right in your wrist kind of pop up underneath your skin. It'll look like it's going right into the center of your palm. So that is the tendon from palmaris longus. So again, if you take your pinky and your thumb and bring them together, and then give yourself a little bit of wrist flexion, you're going to see right in your wrist area, just underneath the skin, a really thin, strong rope. That's your palmaris longus tendon. And it'll look like it's going right into the center of your palm. All right, so its job is going to give you some wrist flexion. All right, now on either side of our palmaris longus are our two additional wrist flexors. So when we look in this view, we're going to see right in the center, this muscle right here, this is all palmaris longus. And then on either side of it, right, so I'm kind of just shading it in green here, on either side of palmaris longus are going to be the two carpi flexors. So we have carpi flexor radialis That's this guy right here on the radial side. Okay, it starts with carpi because we're saying what it's doing. So, well, I should say start with flexor because we're saying what it's doing. So we should say flexor carpi radialis. And that's flexor carpi radialis. Notice it comes off that medial epicondyle. And then on the opposing side, we're going to see that we have our flexor carpi ulnaris. So you say flexor first, and then we say wrist, which is carpi, and then we would say what side of the wrist. So this is flexor carpi ulnaris, and in blue I have flexor carpi radialis, and then right in the middle I have our palmaris longus. Okay, so these are our two flexor carpi muscles. We have flexor carpi radialis and flexor carpi ulnaris. Flexor carpi radialis is going to be originating off of the humerus, again on that medial epicondyle, and it's inserting onto the two metacarpal bones in the hand. That's going to be 2 and 3, so just inside of the thumb. And again, it's going to give us a nice wrist flexion. Because it's sitting more laterally in the hand, we also get a little bit of abduction. So if you want to see this tendon really well, you're going to give yourself a little bit of flexion in the wrist and give it a little bit of an abduction. You're going to see that tendon kind of pop up. Now it's deeper because it's actually going into the palm and attaching to bone, so it's not going to be as superficial as the palmaris longus tendon is. But if you slightly abduct your wrist, and that means you're going to kind of move your thumb outward, right? Your wrist outward towards your thumb side, and then flex. You'll see the tendon or feel the tendon from flexor carpi radialis. It's pretty close to palmaris longus. And then flexor carpi ulnaris is going to be on the medial side of the forearm underneath the pinky. And this one again is originating from the same location, the humeral medial epicondyle. You may also have a little bit of ulna on that as well as the origin. And then insertion are going to be the carpal bones, the pisiform and hamate, and then that fifth metacarpal right underneath the pinky. And if you do a little bit of abduction of the wrist and flexion, you'll see or feel this tendon. It tends to be really, really on the inside edge of the forearm bones. So it's a little bit more to the side of the wrist rather than across the front of the wrist. All right, so those are the two flexor carpi muscles. When I was teaching these with the cadaver, if you look, there's in the top plane of the forearm, there are going to be 3 muscles that sit all kind of almost in the same plane, and those are all wrist flexors. So we're going to have a numerical sort of mnemonic. So I'm always going to say the muscles of the forearm are layered with a 3, 1, 2. So the first 3 muscles are going to be wrist flexors. So we go 3, that's flexor carpi radialis, flexor carpi ulnaris, and then palmaris longus, right? And then we're going to see underneath that there's more muscle. This is a nice isolated view of the 2 flexor carpi muscles. Again, notice they originate in the same location off that medial epicondyle. The insertions are going to be to the 2nd and 3rd metacarpal for flexor carpi radialis. And then flexor carpi ulnaris is going to come across and hit the pisiform, the hamate, and metacarpal number 5. So it has kind of this more lateral position, or sorry, well, medial position on the wrist. Okay. All right. So there's our first layer in the forearm. That's the 3 wrist flexors. They're going to be below the pronator teres, and they're going to be medial to the brachioradialis. If we remove these 3 muscles and look underneath them, we see one very large sweeping muscle that's going to be flexing the fingers. So this muscle is going to be called flexor digitorum superficialis, and it will function to flex the fingers. Oops, there we go. So you can see here, it's going to have an origin on this medial epicondyle, and it's going to swing down and have some attachment into the ulna, and sometimes even a little on the radius. The insertion is going to be all of these individual tendons that come out, and insert into the phalanges. As you'll see here, the tendon is actually going to split right at that distal interphalangeal joint, kind of forms a little V and wraps around that interphalangeal joint. So this is the insertion of the flexor digitorum superficialis. Now remember, it's a single muscle, but you can move your fingers independently of each other. And that's because if you want, for example, to move just your pinky finger, you're going to use motor units that are just going to be isolating, pulling on that one bone. If you want to move your middle finger, you would then engage just simply the motor units that are connected to that tendon. So it's one of the reasons we can remember that when you contract a muscle, you're not contracting the entire muscle, but just simply motor units within it that will provide the appropriate force. All right, so this is going to be our flexor digitorum superficialis. And again, here you can see a large attachment on that medial epicondyle. We're going to see a fair amount of attachment on the ulna and sometimes some attachment onto the radius. It's going to come down and go over the wrist, and then we'll see the tendon inserting around that distal interphalangeal joint where it's going to split and kind of go around those knuckles. All right, so again, origin humerus, insertion phalanges, and then we're going to see flexing the phalangeal joint. All right, so that's the 3-1, and then the last two muscles of the forearm. Again, we're layering this, so we're going deeper and deeper, are going to be two muscles. They're actually going to be the deepest muscles of the forearm because they're attaching to the two forearm bones. So on the medial side, we're going to have a muscle called flexor digitorum profundus, and it's going to have an origin on the ulna and insertion all the way out on the very, very tip of the phalanges, right? So we have the distal tip, and then the second muscle of the forearm is going to be, or deepest muscle of the forearm is going to be the flexor pollicis longus. So it's going to be attaching to the radius and then going out just to the thumb. So it's going to cause thumb flexion. All right, so if we look at flexor digitorum profundus, again, it's going to be attaching to the ulna. We can see this nice attachment point, so it's not attaching at the elbow, or above, I should say, the elbow joint, at the humerus. So now we're finally jumping only into forearm bones. It's going to cover the entire shaft of the ulna, go through the wrist joint, and go all the way out to the distal aspect of the phalanges. Okay, so this is going to give us finger flexion. If you remember, there's that little V where the flexor digitorum superficialis is coming out, and we're going to see that the profundus tendon is actually going to go through. So if I were to draw it, there's like a little V here of the superficialis that's actually right above it. So the profundus tendon is going to come all the way out, and it's going to go through the V of the superficialis tendon insertion, and then all the way out to the distal aspect of the phalange. So this muscle does also cause finger flexion, so flexus of phalange as a primary action. And if you're thinking about your finger, you can actually flex the entire finger, or you can flex just kind of the fingertip. And we still see most of the muscle and most of the finger still rolling in that. But if you're thinking of just trying to get that little fingertip flexion, that's this muscle. So fingertip flexion is really flexor digitorum profundus, and then whole finger flexion is going to be superficialis. All right, so this is the flexor pollicis longus, and it's going to sit on the other forearm bone. It's going to be originating off the shaft of the radius, travels through the wrist joint and out onto the thumb. So this is going to flex the thumb or the pollex. Okay. Now, when we look at all of these tendons that are running through the wrist joint, there's a lot of tendons that are moving through this wrist joint, and they're going to be moving through the wrist bones that have a little bit of a curvature to them, and that curvature is called the carpal tunnel. So when people are doing repetitive finger motions like typing or maybe checking groceries at the grocery store, these tendons are constantly moving back and forth across each other, and that's going to create some friction and swelling, and that's what they call carpal tunnel syndrome. So when these tendons are moving back and forth, they abrade each other, and it creates some swelling. And then there's a nerve that resides in that same carpal tunnel called the median nerve, and that can get impinged or squished. And that's what causes a lot of pain associated with that repetitive finger motion. Let me just bring your attention one more time to this structuring right here. When we look at flexor digitorum superficialis, we're going to notice that the tendon insertion has this nice V right here, and it's going to be inserting around that interphalangeal joint. And we'll see that if you look at the tendon of the profundus, it goes all the way out to the tip of the finger. So this is the profundus tendon coming all the way out to the tips. So it's kind of a neat anatomical design there that allows for you to have both of those tendons inserting under the fingers. Okay, so now we're almost done. We only have 3 more muscles and then we're finished. This is looking at the back of the forearm, and the 3 muscles there are the extensor carpi radialis. It has 2 heads, a longus and a brevis. And then we have extensor carpi ulnaris. And then last but not least, we have extensor digitorum. So if we look at the back of the forearm, we're going to see right in the center is the extensor digitorum. It's going to be originating off of the lateral epicondyle of the humerus, and that's going to be extending the digits 2 through 5. So it gives you the ability to let things go, right? So extending your fingers. And then on either side of extensor digitorum are the extensor carpi muscles. So if we look on the pinky side, we're going to see our extensor carpi ulnaris, and that's coming off of that lateral epicondyle and going to the 5th metacarpal, extending the wrist. And then the last one is extensor carpi radialis longus and brevis. And can't quite see it well here, but I'll show you another figure, is coming off of the lateral epicondyle and going to metacarpals 2 and 3. All right, oops, maybe, no, I don't have a better picture. Well, in the cadaver, I'll show you it there. But there'll be these muscles over here. And there's a long muscle that's a little bit more lateral. And then there's a medial muscle that would be the short muscle. So we have extensor carpi radialis longus. It'll be on the outside. And then brevis is a little bit inside of it. Okay, so this is just kind of be a review. We're finished with all of our muscles, but if we're looking at this posterior scapular view, remember you have the supraspinatus, infraspinatus, and teres minor. We have teres major. So if you were looking, say, what's this muscle? That would be supraspinatus. If we look, we say, what's this muscle? That's infraspinatus. This muscle, teres minor. This muscle, teres major. And if we look this big muscle here, that's the tricep. If I look on this side, I can see the really nice deltoid muscle that's covering the whole shoulder. All right, and then for the tricep, it's a nice reminder that the long head of the tricep is going to come here, and it's going to split teres minor from teres major. All right, so this is a little bit closer view. You can see the cut edge of deltoid here. And again, this is the long head of the tricep, and this is going to be the lateral head, the tricep. You can see the insertion on the olecranon. Okay. All right, this is the anterior view of the shoulder. So we can see the humerus underneath, but we're looking here. This is the bicep muscle. We have the long head, which is lateral. And all our students look at it and say, but it's really short. Why is this the long head? And that's only because we don't see the entire tendon. It actually goes through the intertubercular groove and then all the way up here to attach to the supraglenoid tubercle. So this, in fact, is a really long tendon. So this is the long head. And then the medial head is the short head. The short head is attaching to the coracoid process. So we have 2 scapular attachments or origins. And then we have that nice one strong insertion here on the radius, so elbow flexor. Just medial to the short head, this is the coracobrachialis muscle, so you can see that here. And this is also a nice view of the subscapularis. All right. Oh, if we look at the elbow joint, let me just mention this one. This muscle that's coming across here, that's the brachioradialis. And this muscle coming this way is that pronator teres. And this is that extensor carpi radialis. Okay, so now we're going to dive down into the anterior forearm. Again, we have this really nice landmark muscle. That's the brachioradialis. It's the second of our forearm flexors. Actually, technically the third, because brachialis is underneath bicep brachii. So we can see a little bit of brachialis right here, a little bit of brachialis right there. Remember, brachialis is going to be our elbow flexor as well. So we have bicep brachii, brachialis, and brachioradialis are our elbow flexors. And then this little muscle going underneath the little aponeurosis of bicep brachii, this is our pronator teres. And then we come down into our forearm, and we're going to do that nice 3-1-2. So here we see right in the middle, that's the tendon of palmaris longus. And then on the thumb side, there's your flexor carpi radialis. And then way over here on this inside edge of the forearm is flexor carpi ulnaris, right? Going over here on this lateral side. So we're looking over on that pisiform. All right, and then, so that's the 3, 1, 2, 3 wrist flexors. If we remove them, we see this. It's the very large singular finger flexor, sits in the middle. So this is the flexor digitorum superficialis. You can see the tendons diving into the palm there. So this would be where the carpal tunnel begins. Okay. And then this is looking at the back of the forearm. So in this case, we have right in the center here, all of this is going to be extensor digitorum. And then on the pinky side, that's extensor carpi radialis. And then, or sorry, extensor carpi ulnaris on the pinky side. So extensor carpi ulnaris on the pinky side. And then over here, we have the extensor carpi radialis longus and brevis. And that's going to be, oops, there you go. So there's the brevis, and then there's the longus. So we have longus and then brevis.